I don't know that I would give myself the title of keynote, but I do want to speak with you for a few minutes. I'm going to start by letting you know that I'm so happy that you are all here. It's very, very important to have your voices at the Capitol, so thank you. I see both providers and parents and others, and that's super. I'm going to give you just a few minutes of history about why I feel as passionately as I do about this particular topic. I graduated from college with a degree in special education and early childhood. I took classes specializing in autism and was very excited to get out into the workplace, but as many of us do, I stayed home and had kids for a number of years. And when I did take a job, it was not in a typical classroom. My title was Interagency Family Connection. And probably to those of you out there, your eyes will glaze over because I think it wasn't very descriptive of what I did. My job was to be the first point of contact, or one of the first points of contact, for families whose children were diagnosed with a developmental delay or disability. Those calls could have come from Mayo Clinic or from our local hospital. They could come from a parent who had concerns. And I did that job for about 3 years. And in my last year of service, actually the last 6 months of service, I went to 6 different homes whose children showed signs of autism. It was very concerning to me, visit after visit, and I had been in this job for several years and I wasn't seeing that, and suddenly I was seeing this increase in children diagnosed with autism. It was a tough job, but it was even tougher for the families that I faced, who said to me, the only thing I want is for my child to say mama. That's all I want. And that was a level of pain some of these families were facing. And those of you that are parents out here know that pain, that the only thing you want is for your child, when you walk into the crib and lean over, to be acknowledged. One of the things that happened after that point when I worked with these families is we would try to get them, the school district involved, and it was interagency, so I also worked with public health and social services to try to make sure the children got the services they deserved and that they needed. And we kept running into the roadblock with these families, particularly these 6 young, primarily boys, but 1 little girl, who were diagnosed with autism. They were turned down for services. What we would end up doing, they would go to their insurance company after they had received their diagnosis and a few months had rolled on, and the insurance company would say, "I'm sorry, we don't cover you." And I'd say, well, what am I supposed to do now? So I ended up working with a county, and these children would be diagnosed, or that were diagnosed would be sent into TEFRA, or medical assistance through the TEFRA avenue. And as time went on, and we're seeing it again this year at the Capitol, when state resources get cut, TEFRA and MA services also are impacted. And so these families, who we finally found an avenue for them through TEFRA, had their co-pays go up to such an extent that they could not afford to do that. They couldn't afford, number one, to pay for the insurance company that they had for the rest of their family, as well as to pick up a very expensive copay in the hundreds and hundreds of dollars for their child who needed the services for autism. It was very frustrating. So when I got here to the Capitol, I had an opportunity to do something. My background, as I said, is early childhood special education, and I know I am committed not only for children with disabilities, for children, but all children, that early intervention is key. Early intervention for reading, early intervention for quality child care. That's key to the child's best development, so they can be the very best child and then adult that they can be. So I'm committed to early intervention, and for children with autism, it is even more important that they be diagnosed early and that treatment begin as quickly as possible. For some of our children, they need services that are a little more stringent, that the doctor or the psychologist or psychiatrist may prescribe an intensive treatment for some children. It is certainly not appropriate for all. But those services are the very ones that have the best outcomes for some children, but they are the very ones that were turned down specifically by the insurance companies, many of the large insurance companies in the state of Minnesota. So it was my pleasure to work with a number of you to try to find a way for people who had legitimate insurance policies that were paying their premiums to get the coverage they deserved. So for the last several years, we have been working on this particular bill. There are 2 versions out this year, but the one that you'd be most interested in is House File 1071. We do have a companion now in the Senate. It has not received a hearing. There is a little bit of language for children with autism in Representative Abler's bill, and he'll talk about that, I'm sure, when he comes up here. I would very much like to be able to include the components of House File 1071 in that as well. And what we want is to have equitable coverage for all insurance policies in the state of Minnesota. Blue Cross Blue Shield, if you happen to be lucky enough to have that, is covering some of the treatments, but the other big plans are not. And we think it's fair that if you have insurance, no matter what company you have, you're going to be guaranteed those services, the same services that the state of Minnesota is paying if you buy in through TEFRA. So that's what we're working on, is an equitable insurance coverage. As I mentioned earlier, I'm a little worried about fees increasing for those of you that are on MA through TEFRA. We're seeing a fee increase because, as you know, the state's in a difficult position, and many health and human service areas are being cut. One of those is TEFRA parental fees. So I think it's as important now as it ever has been to get this bill passed. And I'll just give you just a tiny history. Last year, it was in the conference committee. This bill, we passed it on the House side in the last 2 years on the floor. That's very important, and it was passed bipartisanly. And one of the ways we did that is we passed it on an oral vote on the floor rather than having people have to be on the board so that their vote was very visible, because there are some people who were worried about some of their supporters, which might be the business community or insurance companies. They were worried about being on record. So we were able to do this in a bipartisan fashion by saying you don't have to be on the board. You just need to have your voice in the room. And that's what I need from you. I don't need it, you need it. The kids in this state need it, but I need it too as the author of the bill. I need your voice in the room, and I thought very apropos, stand up, speak out. That's what we need you to do. We need you to talk to your legislators. We need for you to say this isn't partisan. This is about our children. This is about raising our children up to be the very best they can be. Early intervention will do it. Insurance coverage is a must. So I'm hoping that by you being here today and showing that you really care about this, whether you be a provider or a parent, that you're going to be willing to do that. So I guess I don't want to take a lot of time. This bill is important. It's not about splitting hairs. It's not about every word being perfect in the bill. I can tell you from years of experience here, there's many bills out there. They're not perfect. They're not perfect when they start. They may not be perfect when they're done. But it's a step in a direction that we absolutely and positively must go to help the kids in the state of Minnesota. So while every word may not be to your liking and may not be perfect, we're willing to take amendments. We're willing to work it out to make it as perfect as it can, but let's not keep stalling this really necessary bill. Let's move it forward. Let's support our children. Let's support the families who are under a great deal of stress, not only in their homes, their marriages. What can we do by providing good early intervention? Those can be alleviated as well. So again, I'm absolutely thrilled that you're here. I hope you'll be in the halls. I hope you'll find your legislator, talk to him, come track me down, although I'm a supporter, so you don't need to ask me to support the bill. I'm ready and willing to do it, and let's see if we can't get it in before the end of session and pass this on. So thank you very, very much for being here.